And 12 News is dedicated to keeping you and your family safe. Tonight, we take a closer look at RSV in the Valley. Cases are ramping up across the state when compared to previous years. 12 News journalist Brenda Lipinski looked into this increase and what we can do to help protect our families. Brenda, this is a very serious virus that can impact and affect so many people.
Yes, it certainly can, Jade, and in fact, it's contagious. According to the CDC, it's the leading respiratory virus sending infants to the hospital, also impacting the elderly and the immunocompromised. According to the Arizona Department of Health Services, RSV cases have been up in Arizona. A recent report shows more than 1,100 cases reported from February 2nd to February 8th, a more than 200% increase compared to the 5-year average of 357 cases reported.
So RSV is a respiratory infection. It stands for respiratory syncytial virus. It's one of the more common causes of respiratory symptoms, usually in young kids around the winter time.
Dr. Vasu Vavarachu with Phoenix Children's Hospital says there's a wide range of symptoms associated with the virus, from cough to sore throat.
Sometimes they have a lot of mucus and phlegm production, and then that can make them look like they're having difficulty breathing. They may not want to eat and drink as much as usual, and they can have a fever that goes with that.
She says RSV symptoms can differ from the flu.
Some people, when they talk about the flu, they've got a lot of muscle aches and they really are exhausted and can't get out of bed. And there's some other types of viruses like RSV where you may not really even realize that you have it. You just have a little runny nose and you kind of go along with your day.
Also differ from the cold.
RSV is a slightly different kind of an infection. It tends to cause more symptoms the younger that kids are because it affects the part of the respiratory tract that's lower down. It can cause a lot of mucus and phlegm in the lungs, a lot of cough.
RSV is mainly treated by what she calls supportive care, like drinking well, resting, and staying home when sick. But in some instances, immediate medical attention is necessary.
You'll start to see them look like they're really struggling to breathe. If you were to look at their chest, you might see some labored breathing, might see their ribs showing or pulling or tugging.
Whether the cold, the flu, or RSV, she says prevention strategy is the same. Washing your hands, staying at home.
It's so important to keep that contagious droplets within a closed area. That could include wearing a mask so you don't get other members of your own family sick.
Now, according to the CDC, there is a vaccine for older adults, a vaccine for mothers during 32 to 36 weeks of pregnancy, as well as RSV monoclonal antibody given to infants whose mother did not take the vaccine and infants at high risk.